Good afternoon, everybody. We are about 1 minute out. Good afternoon, everyone. I'm Nirav Shah, the Director of Maine Center for Disease Control and Prevention. I'm joined this afternoon by Commissioner Jeanne Lambrew from Maine's Department of Health and Human Services. Commissioner Lambrew and I are pleased to be with everyone this afternoon to discuss where we stand with respect to COVID-19 for today, Wednesday, February 16th, 2022. We begin today's update on unfortunate and another sad note. Maine CDC is reporting an additional 9 deaths associated with COVID-19 today. These 9 deaths bring the total number of deaths in Maine associated with COVID to now 1,858. We'd like to take a moment to offer our condolences to the friends, family members, and communities of those who have passed away throughout the pandemic. Overall, Maine CDC has now recorded 202,221 cases of COVID-19, an increase of 3,556 cases since yesterday, and an increase of 14,500 cases just over the past few days. I want to take a second to pause on this. There has not been some remarkable super spreader event in Maine. The reason for the increased number of cases is that, as we've talked about, Maine CDC has been working through our process of clearing out the backlog of positive test results that were awaiting processing. We've been doing this through a series of newly programmed AI tools, or bots. This process of utilizing these bots to plow through the backlog will continue over the next several days as we clear through the backlog, which as of right now stands at 30,300, which right now stands at 30,300 cases. Turning next to hospitalizations, as of this morning, there were 249 people hospitalized with COVID-19 in Maine. That is the same number of people who were hospitalized way back on November 14th of 2021. To put that number in perspective a bit further, 2 weeks ago in Maine, there were 344 people hospitalized with COVID. Today, again, that number is at 249. Of those 249, 63 are in an intensive care unit, whereas 2 weeks ago, 83 were in an intensive care unit bed. And right now, 29 people are on a ventilator, whereas 2 weeks ago, that number was at 38. Turning next to testing. Right now, Maine's PCR positivity rate on a 7-day basis stands at 7.9%. And our volume of PCR testing stands at 460 for every 100,000. I want to take a quick second to talk about therapeutics for COVID-19, something we haven't touched on recently. If you are at high risk of getting very sick from COVID-19, perhaps because of a pre-existing health condition you have, and you happen to test positive for COVID-19, treatments are available. There are now several medications available to treat COVID-19. Some of these are oral medications, and some of them are received through an intravenous or IV line. If you have COVID-19 and you are at risk for a severe disease, the Maine CDC recommends that you contact your healthcare provider to find out if you should get one of these medications. In Maine, these medications are available at some, but not all, pharmacies as well as hospitals around the state. It's really important that you get tested as soon as possible after your symptoms begin, And that's because treatments with these drugs must be started early in order to work. I'd ask everyone to take a second to go to maine.gov/COVID-19 to learn more about COVID-19 therapeutics. Sorry, just 1 second on a technical difficulty. Okay, going back next to vaccines and vaccinations. Right now, Maine is administering 1,609 doses of COVID-19 vaccine every single day. And over the past seven days, about 54% of all the vaccines that we're administering are boosters. This significant effort has been paying off. Maine right now is 78.1% fully vaccinated for every single person in our state. And of those who are fully vaccinated, 53% have also received their boosters. Commissioner Lambrew and I have a few announcements that we'd like to make today around schools. Commissioner, I'll turn it over to you now.
Great, thank you so much. I am pleased to announce that ahead of the school vacation week, Governor Mills has expanded eligibility for Project Access COVID Tests, or ACT, to all Maine households. Originally limited to residents in certain communities, now every household in Maine is eligible to order a set of 5 at-home rapid tests on the website www.accesscovidtests.org. No payment information is required. Both the tests and shipping are free to residents, and the tests will be delivered through Amazon approximately 1 week after ordering. These home COVID-19 tests are being provided as part of a 6-state pilot organized by the Rockefeller Foundation. So far, 76,680 of the 125,000 free COVID-19 tests have been mailed directly to the homes of Maine residents. The program is limited to 1 order per residential address during this first phase of the project. Any individual over the age of 2 can use these tests. Maine residents can also order free tests through the national initiative at covidtests.gov. More information about accessing tests can be found at COVID-19 Testing in Maine website. With the February school vacation starting on Monday, February 21st, we encourage families and school staff to take advantage of this option. Testing before returning to school following the vacation will help prevent school-based transmission of COVID-19. Any Maine resident can visit Project ACT website at accesscovidtest.org to place their orders. Now with that, I'll turn it back over to you, Dr. Shah.
Great, thanks, Commissioner. I've got 2 additional things that I wanted to talk about today as it relates to schools. The first is around contact tracing, and the second is around masking. Let's start with contact tracing first. Over the past several weeks, we've talked about contact tracing. As a reminder, this is the process of identifying close contacts of people with COVID-19 and reaching out to them to let them know that they've been exposed. Several weeks ago, on January 12th of this year, the Maine CDC recommended a shift in contact tracing in schools. We recommended that schools could suspend contact tracing, provided that they had a mask requirement in place. After further discussions, consultation, and collaboration with superintendents across Maine, today, the Maine CDC is consciously uncoupling those 2 things. We are uncoupling the mask requirement from contact tracing. What does that mean? Well, going forward, the Maine CDC has revised our recommendation to allow schools to suspend contact tracing regardless of whether they have a mask requirement in place. We're doing this after discussions with superintendents because the continued data showing that the Omicron variant spreads quickly, so quickly, in fact, that contact tracing loses its effectiveness, regardless of whether there is masking in place. The second thing I'd like to talk about today is masking in schools. Now, everyone's aware there's been quite a bit of interest across the country, across the state, as it relates to masking in schools. Now, of course, the state of Maine does not mandate masks in schools. The Maine CDC recommends masks in schools right now, but the ultimate decision is one for schools and their districts. Masks are important. When rates of disease are high and vaccination rates or prior immunity rates were low, masks were a significant reason why Maine was able to keep schools open and keep kids in those classrooms. But things are changing. Rates of COVID are falling. And vaccination rates among school-age children in Maine, even though they could be higher, are strong. 54% of all school-aged kids in Maine, from 5 through up to 18, 54% of those kids in Maine are fully vaccinated. For the 5 to 11 population, 38% are fully vaccinated. And for 12 to 19-year-olds, it's 68%. When you couple those numbers with the number of kids who have recently been infected with COVID-19, about 35,000 since the beginning of this school year. Those kids, coupled with the number of vaccinations, have some degree of immunity. And what all of that means is that we are starting to see that the risk of transmission in schools is lower. Now, at the same time, there are some things on the horizon that we're keeping an eye on. The February school vacation is coming up, and such vacation weeks have been a potential source of upswings in cases. That's one reason that Commissioner Lambrew noted our ask for families to order at-home tests with the expanded program so that kids can test before they come back in on the 28th. We're also continuing with pooled testing, again, to catch cases in schools before they turn into outbreaks. But these lower trends present an opportunity to revisit our recommendation to mask in schools. This is a prudent thing to do. We recommend masking and have done so to reduce the risk of transmission in schools and to keep kids in the classroom. The risk of transmission in schools is tied to the overall level of COVID in the community. As COVID rates in the community come down, the risk of transmission in schools comes down, and thus the need for masking goes down. Basically, when it stops raining, you don't need your umbrella. Now, as we've always done, as the situation on the ground evolves, so too will our recommendations. When it comes to masking in schools, we're not there yet. The trends are encouraging and the trends are favorable. What we are looking for now is continued stability. More stability in terms of decreasing hospitalization rates. More stability in terms of lower positivity rates. More stability in terms of falling rates of COVID in wastewater testing. The trends right now are favorable, but let's see if they are lasting, especially after next week's vacation. In short, the bullet train that is Omicron is slowing down, and that's a good thing. We don't let off the brakes while the train is still moving. So what does all this mean? After next week's school vacation, the Maine CDC will revisit our recommendation around masking in schools. We will take into account the favorable trends that we've seen recently. We will look for stability in those trends and keep an eye out for upswings related to next week's vacation. As it was with contact tracing, we will be doing all of this in consultation and collaboration with school superintendents. I've been personally meeting with them to understand how public health guidance is working at the ground level. My team and I will continue to do so. Again, as we come out of next week's school vacation, Maine CDC will revisit our recommendations around masking in schools and look for signs of continued stability. As we see those, Commissioner Lambrew and I will look forward to being back with everybody to provide updates on where we stand. So with that, I'm going to turn to our colleagues in the media for some questions. The first question for the afternoon goes to Corey from WAGN.
Good afternoon, Dr. Shah. So my first question is about the masking in school. I read that you had recently met with, I believe it's the Maine School Board Association, and you're planning on meeting with the superintendents there. What are some of the metrics that you'll be looking at in order to make that recommendation to, ease or roll back masking requirements in schools?
Yeah, sure thing, Corey. Right now we're looking for stability. I mentioned some of the metrics that we have been looking at, things like hospitalization rates, wastewater testing rates, looking for COVID across the state. What we're looking for now is continued stability in those metrics. The trend is favorable, but we're keeping an eye out for things, for example, like next week's vacation. Those vacations have the potential, not necessarily a guarantee, but the potential to lead to a series of upswings. And as we're considering removing or moving our recommendation from one of recommended to optional, we want to make sure that we are primed, that schools are in the safest position as possible before any such recommendation moves from a recommendation to an option. And that's why we're keeping an eye out for how things evolve after next week, as well as looking for continued stability. Where we are right now is favorable. It's encouraging. We want to just see those trends continue.
And my next question has to do, continuing on with schools, with the state high school basketball tournament that's going to be starting on Friday. They do have a masking requirement, but what are some things to be concerned about? What's the risk level, if you were to assign a risk level to the people that are attending that game, in the crowded spaces?
Commissioner and I have discussed this exact issue. Corey, I'll turn that over to her.
Sure. Well, I will say that when it comes to sports, the Maine Principals Association has set guidelines for school sports in Maine. So we defer questions about the guidelines to the Maine Principals Association. And Director Shah, I'm not sure if you want to talk about the risks.
Corey, as it relates to indoor gatherings like that, we're recommending that folks be smart, be prudent. It's what folks in Maine have done throughout the pandemic. One of the best things, although the tournament's coming up, so it's a bit late, but it's never too late to get vaccinated. Even though you won't be fully vaccinated, every day closer to an event helps. And certainly if you're somebody that, in line with the Principals Association guidelines, want to be wearing a mask, that's certainly a smart thing to do, particularly if you are in contact with family members who may be immune compromised, things of that nature. Fundamentally, we're all in this place where we're going to have to balance all of the risks for each of us.
Thank you. My final question actually has to do with keeping on the mask area there. So would a large percentage of the N95 and KN95 masks that are available on the market, you've said before, are likely counterfeit. What's the level of protection that a counterfeit N95 or KN95 mask provides? Maybe comparing them to the cloth masks or the surgical masks. Is it better than better to go with the counterfeit than to have a lesser mask?
Corey, I don't know, nor am I able to quantify what percentage of KN95 or N95 respirators that are available. I'm not able to quantify what percentage of those are counterfeit. I suspect it is ebbed and flowed throughout the pandemic. Generally speaking, you won't find me endorsing a counterfeit product. We want to go with the real deal, simply because even within the realm of counterfeit, there is a wide spectrum. Some may have clasps that are different. Some may have completely faulty material altogether. So I don't think there's any room here to suggest that any type of counterfeit mask is a second best solution. We should all be taking steps to make sure that the products we're using are bona fide, that we're acquiring them through reputable sources and not settling for something that's counterfeit.
Thank you.
Yep, you bet, Corey. Let me go to Patty White next.
Thanks, Dr. Shah and Commissioner Lambrew. I wanted to ask about excess deaths during the pandemic. Data from the US CDC shows that Maine has seen a 10% increase with about 3,000 more deaths than normal. And of course, you said at the beginning that about 1,800 of those are directly related to COVID. But what do we know about the other 1,200 deaths? What are the most common causes and what are the factors driving the increase?
Yeah, thanks for that question, Patty. One note, Patty, is that, as you'll recall, having heard me say from time to time, we take an extra step that I think is important, which is we go back from time to time and look at all of the death certificates, all of the vital records that are reported into Maine CDC to determine if COVID is listed by the treating physician, by the pronouncing physician, as a contributing cause of death. That's a really important step, Patty, and I'll connect it to your question. Many individuals may, for example, been a household contact of someone who had confirmed COVID-19, a spouse, a sibling, so on and so forth. And they may have come down with symptoms that are entirely consistent with COVID, but in an effort to stay inside, maybe didn't get tested. Their provider, and if those individuals die, sadly, their provider, knowing of that diagnosis of the sibling or spouse, may have listed COVID-19 on the death certificate because in all likelihood that person had COVID and succumbed to it. We scour those records for those cases of individuals who died but may not have tested positive for the reasons I outlined. That's one reason I think our numbers, even though we can't capture everything, we've got greater fidelity into what's happening. Now, in terms of the roughly 1,200 or so we estimate are not captured, those are individuals, for example, for whom the attending physician may not have listed COVID on the death certificate. There are studies underway at the national level to understand better how those individuals may differ from those that we know. Sadly, the early findings from some of that research are concerning. These are individuals, for example, who may have lacked easy access to healthcare and thus couldn't get tested. They may not have had a regular primary care physician who was able to understand the spectrum of what's going on. These are folks that probably were already facing challenges in accessing healthcare through the various social determinants of health that they faced. All the more reason for us to continue that core work in public health of making healthcare easy and accessible.
Okay, thanks. So are you saying those 1,200 deaths, there may be more of a link to COVID than it appears right now? It's not due to, heart disease and people couldn't get to the doctor because of the pandemic.
It could also be that those are where you're going to there, Patty, are secondary effects or indirect effects of COVID. Individuals who weren't able to make it to their physician's office. That's certainly a feature as well. I was just zeroing in on the subpopulation who likely had COVID but weren't able to obtain a diagnosis because of the various challenges they faced. There's no question as well, Patty, that there is a high number of indirect deaths that are associated with the pandemic, not necessarily driven by COVID itself.
Okay, thank you.
Thank you. Let me go to Eric Russell next.
Thank you, Dr. Shah, Commissioner Lambrew. I got a couple of questions. With the backlog already significantly reduced and the number of positive tests coming in each day also way down from what we saw a couple of weeks ago, it seems to reason that the backlog will be cleared by next week, let's just say, for argument's sake. If that happens, do you see as daily case counts becoming a more reliable metric, or would you still shy away from that because of home tests and things like that?
Yep, you pretty much, yes, Eric. That's the bottom line. Yeah, I mean, you're correct. I didn't correct as to the projection of timing that you mentioned. You're also correct as to the daily number of positives that are being reported. And I don't think this will resurrect the value of the daily case count. And I'm not just saying that as to Maine. I've been in close communication with counterparts of mine across the country, and we have been urging the US CDC to rethink the value of the daily case count as the metric of the pandemic right now. So even after all of this is cleared out, because of factors like home tests, as well as a couple others that I'll mention in a moment, Eric, we don't think the case count really tells us what's going on. One of them is home tests. The other is that right now, with the dominant variant being Omicron, it's milder on an individual level. That, coupled with higher rates of vaccination, mean that more people have mild cases or even asymptomatic cases, and thus don't test at all, even though they might still be capable of spreading it. So all of these things mean that the case count just doesn't tell us what's going on.
Okay. The other question I had is, actually, I just have one clarifying question first. You said you're going to revisit the mask recommendation for schools after the February break. Does that mean immediately after, or will you need a little bit of time to sort of see whether we've got a spike? Can you just clarify that?
Yeah. Yeah, I definitely can. We need a little bit more time. Okay. As you know, Eric, it won't be that Monday when we see any potential uptick. We'll need several days, or at least several days, to understand better whether there has been an upswing, as well as to look for that continued stability in the broader population health metrics as well. I don't want to put a date on it. We're going to be doing it. I want to definitely note that we are going to be doing it. And we'll be doing it. It's not just sort of a one-time thing. It's not as if there will be one instance where we will look at things. We're going to be looking at it continuously for several days to both look for a potential upswing as well as more stability.
Thank you. And the last question I had is a little bit more of a philosophical question, so you may not want to engage, but if you remember back about a year ago, a little less than a year ago, we had a lot of positive trends heading into the spring and summer of 2021, and everybody was very excited. They burned their masks in some cases. They did all of these things that suggested that the pandemic was over. Of course, that's not true. Delta came and now Omicron came. And what is the risk right now of rushing to get past Omicron to live our lives again for the first time in 2 years, where it isn't really over? Like, how do you balance those two things? And what's your messaging on that?
Yeah. One thing that differentiates, and Commissioner, welcome, please weigh in on this too. One thing that differentiates now from then is the even greater availability of vaccines. Right then, a year ago, vaccines were starting to be opened up, but they were still supply limited, so on and so forth. And so there was more risk inherent in unfurling a banner that said mission accomplished back then. We're not doing that now either, just to be clear. But there was more risk because vaccination rates were so much lower. So the risk of doing so now is not zero. Let me be really, really clear. If you take a look back at the 1918 pandemic, what you see is that there were similar patterns to the current COVID pandemic. Fits and starts where people thought that things were over because they were in a trough, where in fact they were just waiting for the next surge. But the other thing you see with those is that the surges became a little bit more attenuated with time. Our vaccination rates, particularly in Maine, mean that if there were an uptick, we would be able to withstand it better than, say, a less vaccinated state. But just to be clear, Eric, we're not unfurling any banners. There is a subvariant that's been working its way right now across Scandinavian countries, Denmark and Norway in particular, that seems to be even more contagious than the classical Omicron variant. We're keeping a close eye on that. We haven't found it yet, but one of the surest ways to guard against or steel ourselves against the arrival of that next variant or the potential surge, no surprise, is to go out and get vaccinated. I know we're tired. I know everyone wants to be over with it. We've just got to counterbalance that desire with being vigilant for what's down the pike. Commissioner?
Sure, and I'll just add, Governor Mills said this in her State of the State last week. We do have to be prepared to expect the unexpected. And that's what our job is, not just with COVID-19, but with any other potential natural threat or other type of challenge. So we have learned from several sets of surges, including being ready for testing. We have a testing plan to make sure we can surge as needed should we be back in that situation. We have learned a lot about a hospital plan. How do we make sure we maintain our hospital capacity if we see another surge of COVID-19 or other types of disease? We've certainly learned about personal protective equipment and other tools to keep schools and other sites safe. So we have, each time we've gone through in this past 2 years, hit one of these challenges, not just adapted to it and responded to it, but turned around and looked and see what worked, how do we prepare for what comes next. So should indeed we find ourselves seeing an upswing of COVID-19, some variant or some related disease, we'll be even more prepared than we were previously for it.
Thank you both.
Thanks, Eric. And best of luck in your new gig or your modified gig. Megan, let me go over to you next.
Hi, thanks for taking my question. This might be more of a clarification, but when you go to revisit the recommendation about masking, would it be a blanket thing where you would change the recommendation to an option if that were to happen for the entire state in schools, or would you change it depending on vaccination rate by county? Would the recommendation change depending?
I can't speculate one way or
Okay.
the other, Megan. We really want to see what the data are and what kind of stability we've seen in those trends. I can't say one way or the other.
Okay, all right. Well, my second question is about the vaccine for children under the age of 5. I think it was on Friday where the FDA said, yeah, wait, we're not going to decide this just yet. We want to see if there's more data about what the dosage will be, if the third dose is needed. And I think, we thought that it was going to happen sooner than it likely is going to. And so I know a lot of parents of kids in that age range, myself included, sort of feel like you're in, back when everything first started. And I think seeing what, that 5 to 11, I think we're in like a upper 30% vaccination rate there, if I'm not mistaken. And so my point is that this seems like it might create more PR issues, if people were at all reserved before about getting that 5 and under age group vaccinated, this might put the brakes on even a little bit more for a parent considering it. So when you hear something like that, what is the messaging from you guys about that vaccine? And should parents be any more wary of that age group considering, what the FDA or what they've decided as of last week to kind of hold off slightly?
Yeah, Megan, I'm glad you raised that. That's been a topic of discussion since Friday's news. So let me just talk directly to parents of kids in that age group from 6 months up to 5. The news on Friday afternoon that the FDA and Pfizer, the manufacturer, were going to pause the immediate review of that vaccine. I'm sure for a bunch of parents, that was just a gut punch. We had heard all week and the week before that the FDA was spinning up and the CDC was getting ready. And then all of a sudden on a Friday afternoon, they put the brakes on everything. It's reasonable, I think, that a lot of parents will not only be disheartened, but also question whether there's something deeper going on. Megan, as you noted, the reason for putting the brakes on was not out of concerns for safety. It was really that they wanted the regulators wanted to see all the data around the third dose, rather than going out with 2 doses now and then waiting to see what the third dose may bring. They decided that the best thing to do for vaccine confidence was evaluate all the data for all 3 doses at once. Megan, in my mind, and for parents who are out there, this should strengthen confidence in the vaccine, not diminish it. This is our regulatory system at its best. Rather than taking chances on what the data on the third dose may bring, they decided to do a prudent thing and pause to wait for all the data to come in before making any regulatory decisions around it. If anything, this is not just the scientific process working, it's also our regulatory process working. I know that there will be a lot of questions about this when that vaccine, if it becomes approved and authorized. That's certainly something that all of us will be discussing. But for right now, what I want folks to know is that this is regulators being prudent and careful and not rushing to judgment.
Thank you.
Thanks, Megan. Let me go to Amy Brown next.
Thank you, Dr. Shah and Commissioner Lambrew. I have a question from listeners and then one for myself. A couple of listeners have asked about medical practices that might be exempt from the vaccine mandate, and specifically an optometry practice. Told a couple of listeners that they are not required to follow the mandate. I know dental offices were kind of exempt from that, but are there other medical or sort of quasi-medical types of facilities that people cannot count on everyone being vaccinated at?
Maybe Director Shah, I'll answer that. So the Maine healthcare worker vaccination rule is a long-standing one. It actually goes back decades. When we in the past year updated it to include COVID-19 vaccines alongside flu vaccines and other different types of disease vaccines, we ended up keeping the footprint of that rule, meaning we kept the same set of facilities subject to the rule that have always been subject to the rule. And that history is primarily because it is in facilities where patients go and they stay and they have repeated contact with healthcare workers, that the importance of vaccination is heightened. Again, it's still high in other healthcare settings, but that's the history of the Maine rule. And I would note that the federal government, through the Centers for Medicare and Medicaid Services, implemented a similar rule that was recently upheld by the Supreme Court. It too focuses primarily on healthcare facilities.
So who's not covered by that? What's not considered a healthcare facility? What are some of the major dentists? Are you saying optometrists are not covered under the mandate?
Yeah, most practices, group practices where you go for a visit and you leave, are not covered by the Maine or the CMS rule. All that said, we do have a list of who is covered and not covered under the frequently asked questions on our website.
Okay. And in connection with that, there are people who have asked before they go to a doctor's appointment. And there are some people who are being very cautious because they are at higher risk, have asked, are all of your staff vaccinated? And they've been told, in what I believe is a misunderstanding of HIPAA, that they cannot release any information about their staff because of HIPAA regulations. Is that the correct interpretation of HIPAA?
So I am not a lawyer, so I don't want to give a definitive answer about what can and can't be released under HIPAA. I do know that some of our healthcare providers in Maine do provide that information to their patients to assure them if the patient is concerned about that. And patients who themselves are concerned can ask, and if they either get an answer that they don't prefer or they don't get an answer, they can always look around to find a provider who can assure them that they are fully vaccinated.
Okay, great, thanks. And my question is, Dr. Shah, I asked a few weeks ago about a second booster shot, and at that time, you were thinking it likely wouldn't be necessary for most people. Since that time, there's been reports that the boosters are wearing off at about 4 months. Has that changed your thinking, or with the decline of cases, do you still feel that one booster shot is enough for most people who aren't immunocompromised?
Well, Amy, we really take our cues on these matters from the US CDC and the US FDA. They really set booster policy, not at a state level, but at a national level. And according to the US CDC, at this time, a second booster shot for folks who do not have any type of immune compromise isn't something that's needed. They are, of course, always monitoring those data. But if you're somebody who is immune compromised, you should absolutely be getting both a third shot and a fourth shot. That's been in place for a while. And if you're watching right now, and you're immune compromised and you haven't gotten both of your boosters, now is a great time to do so.
Thank you. And just quickly, of the 9 deaths that you reported today, did all of those occur within the last day or two, or some of those as a result of records review?
I do not believe those are a result of vital records, Amy. Those were recently reported to Maine CDC.
Okay, thank you.
Thanks. Brian Sullivan, over to you.
Thanks, Dr. Shah. I'll follow up on Amy's question. We had a viewer call, reach out to us and ask about being over 65 and if that it would make them what you would call immunocompromised. What are some of the characteristics that would put a person who maybe doesn't have any, I think you'd call them pre-morbidities, or maybe I'm using that wrong, but how does a person know if they need that second booster?
Yep. Simply being over the age of 65 does not make you immune compromised as it relates to this discussion. Folks who qualify for this almost certainly are aware of their status as being immune compromised because they're almost certainly under the care of a transplant surgeon, an oncologist, or a rheumatologist. These are folks that have medical conditions like an organ transplant, or have been or are being treated for cancer, or are taking any number of drugs that can suppress their immune system. Again, these are folks that are almost certainly already under the care of a specialist and almost certainly know that they have a condition that suppresses their immune system and thus makes them eligible for 2 boosters, as well as one of the therapeutics that I referenced earlier.
Thank you. And then this is probably for you Commissioner Lambrew, and maybe going back to Corey's question about the return of the high school basketball tournaments in Bangor, Portland, and Augusta. Just interested to know what, if any, conversations between yourselves and the MPA took place, advice that you gave, or questions they had about how things should run. If you could just offer us a little insight about the talks you guys have had leading up to these events.
Sure. I think it could be quick, which is, as a reminder, during 2020 and into 2021, when the state of Maine was doing its own COVID-19 checklist and guidance, including community sports guidance, we did engage with organizations like the Maine Principals Association on that set of guidance. Since last May and June, with the end of the state of civil emergency, we turned to US CDC guidance as the set of recommendations that we urge all of our different sectors, be it businesses or schools or other organizations, to follow. Since that time, we have not been engaging on state-specific guidance regarding things like school sports.
Okay.
Thanks, Brian. Emily, over at the Sun Journal, over to you next.
Hi, good afternoon. So Eric Russell kind of stole my thunder with that last question, but I have a follow-up. So I'm wondering, you said at the top that the bullet train of Omicron is slowing down. That's not the time to let off the brakes. So do you have an idea of what things would look like when it is time to let off the brakes? With these peaks and valleys with COVID, it's obviously hard to tell when it's going to happen again. So is there a time where we can kind of come back together fully and treat, I don't want to say endemic, but, think of COVID more as like the seasonal flu. It can be lethal, it can be dangerous, but it's something that we live with.
Well, I'll start by picking up where the commissioner noted in connection with Eric's question. The governor laid much of this out at the State of the State speech last week. And Emily, I'll take your question in the direction you're going, but start with the following, which is, I think it's useful to talk about right now what our goals are. What are we doing, and what are we trying to accomplish with our response? The governor laid that out. We're trying to reduce the strain on hospitalizations and keep the healthcare system going. We're trying to prevent the worst outcomes of individuals who get COVID from being hospitalized and ending up in an ICU on a ventilator and dying. That's one reason I mentioned the therapeutics earlier. Those are the goals of our response. Of course, on top of that is making sure people have access to vaccines and so on and so forth. All of this is to say, though, that we shouldn't assume that because things are getting better, that COVID will forever be in the rearview mirror. What we've seen with prior pandemics, whether it's influenza or others, is that they stick around in various and different ways. It is likely that there will be upswings in COVID-19. Our goal now is to steel ourselves such that if and when those upswings happen, maybe they will be seasonal, maybe they will be driven by the emergence of a new variant, we can't predict. But when they occur, we can spot them and respond accordingly. None of that is inconsistent with COVID being something endemic. Endemic, essentially, in this context, means that it's something that, even though it ebbs and flows, we can manage without overwhelming the healthcare system. That really is our organizing principle right now. COVID's not going away. We're not going to eliminate it. We're not going to eradicate it, but we can be prepared to spot and respond to potential upswings.
Okay, and I have a reader question who was asking, she said her adult son got the Johnson & Johnson vaccine for the initial shot and then Moderna for the booster. And I'm wondering if, she is wondering if having J&J, which we know has somewhat less efficacy than Moderna or Pfizer, is, I guess you could say, canceled out by getting that Moderna or Pfizer booster.
Yep. So here's the other element of that question, though, Emily. There are some data to suggest that one aspect of the vaccine's efficacy with J&J is a little bit lower. However, there are other data to show that the J&J vaccine might fare as well, if not maybe even a little better than the mRNA vaccines on another parameter, which is longevity or durability. The response may not be as robust, but it seems to persist for a slightly longer period of time. That coupled with that individual, that adult person getting an mRNA booster for their booster shot actually is a good blend. That's what the US CDC recommends. If you got the J&J shot, you get Pfizer or Moderna as your booster. And although all of the studies with these various mixes and matches are still underway, there's good reason to think that that combination will provide good and long-lasting immunity.
So if someone got Moderna or Pfizer for their initial series, should they be running out to get J&J, or are we kind of all good because the booster is providing that longevity?
It really, the magic there is being done by the booster. The more we learn about COVID-19 vaccines, the more we see that they are a 2 or 3 dose series of vaccines. 2 doses if you got J&J, 3 if you got Pfizer or Moderna. And what we really are seeing is that it's the booster that's really locking that protection in. So having had the mRNA booster, no matter what you got the first time around, that's really the key. That's what the US CDC recommends.
Okay, thank you.
Thanks, Emily. Let me go to Chris Costa next.
Hi, Dr. Shah, Commissioner Lambrew. My first question, if you don't mind, is for Commissioner Lambrew, because you talked about the expansion of the Rockefeller pilot and the tests. So I noticed that you said we're expanding the eligibility now to everybody. At first, I think I remember you mentioning, I think it was either last week or 2 weeks ago, that it was initially dedicated towards socially vulnerable zip codes, areas where people might have a struggle accessing some testing. Can you help us understand why the eligibility was expanded? Was it a lack of, I mean, clearly there was a lot of interest because there were 76,000 tests sent out. Was it a lack of interest, a dip in interest, or did we get more tests that allowed us to do this?
It's a good question. We're excited about the 76,000 tests that got distributed to these households. We will continue our work to provide access to testing in those communities. And as a reminder, we're not saying that they no longer are eligible. They too are eligible along with other areas of Maine. But going to what we're trying to do with this pilot, which is again a test, is to see how this program works and can we really use it to the maximum potential. And with school vacation coming up, we do know that, again, if past is prologue, people are traveling, people might be gathering more, and there's an elevated risk. So we decided to pivot this pilot to be available to all Maine residents so we can give them this effective tool, which is a home test, to make sure if they think they got exposed to somebody as they were on vacation, they can test, find out they're COVID positive before going back to school or work the following week. So it is just the next phase of this pilot, which if successful, Maine will figure out if it continues in the future.
Okay, cool. Awesome. Dr. Shah, you talked earlier about the therapeutics. I think if I remember in previous weeks, we've said that the supply of those has been strained. I don't know if it was specifically maybe was it the antivirals? You're going to have to refresh my memory on this, unfortunately, but can you kind of tell us where the supply stands now and how people should go about getting those?
Yeah, thanks, Chris. The supply remains strained, but it's getting better every week. One reason for that is that on Friday, the US FDA granted an emergency authorization for another one of these monoclonal antibodies. It goes by the unpronounceable name bevtelovimab. Yes, I definitely practiced that. And Maine is going to be receiving doses of that in addition to the other monoclonal antibody that we've also been receiving, goes by the name sotrovimab. Those are the infused products. There are also 2 oral medications, one from Pfizer, the other from Merck. We've seen uptake for those, but we want to get the drugs out more. The drugs are remarkably effective. They keep people out of the hospital and they keep people alive. So the best way to access them is twofold right now. The first is if you just tested positive for COVID, either at a home with a home test or at a testing site. These drugs require an evaluation. They're not like a vaccine where you can just go to a pharmacy and get it. You've got to talk to your doctor because different folks are eligible for different drugs based on their age or other medications that they might also be taking. So the first thing to do is to reach out to your physician to get evaluated and then get a prescription. The other thing we're working on is making them more accessible in centralized locations at different, for example, hospitals across the state. So if you don't have a doctor or your doctor's office can't get you in for a couple days, you can go to one of these sites and get tested, evaluated, and get a prescription all at one stop. So we're working on those. Our team is working with hospitals to open those and roll those out. But right now, the most appropriate approach is to be in touch with your physician.
Okay. And there was one thing that you mentioned earlier that I just wanted to kind of clarify on, because I think I'm hearing two different things, and I think you can help clear this up for me. It has to do with masking and Omicron. When you were talking about the contact tracing in schools, you were saying that the Omicron variant spreads so quickly that contact tracing ends up being not effective regardless of masking. Then later on, you were also saying today, it's obvious that masks have helped us in so many ways in preventing the spread of the virus. So can you help me understand kind of the difference there? Is there something about Omicron that's evading masks? I feel like this is a question that we asked, like months ago. Or
Yeah.
sorry, not months ago, you know what I mean, weeks ago.
Yeah, no, it's a good pickup, Chris. No, there's nothing per se about Omicron as it relates to being able to evade masks. The reason for removing the mask requirement from the contact tracing is as follows. Basically on January 12th, what I went out and said was masks are a safety mechanism. Contact tracing is a safety mechanism. If you're going to stop contact tracing, we want you to have at least some other safety mechanism in place. If you're going to get rid of the safety net that is contact tracing, have masking in place. Well, what we've seen since then, and looking at data from Maine as well as looking at data from other states, is that the two are really distinct. And that's why we're consciously uncoupling them. Contact tracing, no matter what the masking status is, just is not able to keep pace with how quickly Omicron can move. Irrespective of whether masking is in place or not, contact tracing doesn't have the value that it did with prior variants, Alpha, Beta, and Delta. And that's why we're changing our recommendation for all schools, regardless of their masking status, to being able to allow them to suspend contact tracing.
Gotcha. If you don't mind, just these last two are really quick hitters. I'm hoping it can be just like a very quick answer. The percent of unvaccinated people who are breakthrough cases, I think last week you had said it was kind of hovering around 50 to 60%. Is it still around that now, or has it changed?
That is in hospitalized patients, Chris.
Sorry,
just to be clear.
sorry.
Yeah,
Yep,
just for clarity. And no, it is still in that 50 to 60% range. We'll have new data on that tomorrow, but as of last Thursday, it was in the 50% range. I can pull it up real quick.
Okay, then the last question for you. Again, last week you had mentioned the wastewater testing, saying we were going to need several weeks in order to establish a baseline, and then a couple more weeks to see if we're seeing a change. Is that kind of still the case? Do you know kind of what we should be interpreting from the data that's available?
Yeah, you're right, Chris. We're at the point where we've got a baseline in place now, and we've seen even dates of testing samples beyond that baseline, and they have all suggested significant reductions in the volume or the amount of COVID across the state. I really urge everyone to take a look at those. We put the reports on our website. There's also a US CDC dashboard that has a lot of the main sites listed. The results are quite encouraging. Almost just really significant declines week on week. So it's good stuff, and it helps inform the discussion that we've been having and talking about around masking.
Excellent. Thanks so much for your patience and allowing me the extra question.
Yep, no problem, Chris. Let me go to Caitlin Andrews next.
Good afternoon, Dr. Shah, Commissioner Lambrew. Can you hear me okay?
Yep, sure can, Caitlin.
Great. I know sometimes I have connectivity problems in the past. My first question is about the Wilton call center. Some members of the Franklin County delegation are asking about the decision to close that. And I was wondering if you guys could just tell us a little bit more about the decision to move those jobs to Lewiston instead of renewing the lease there, and give me a sense of whether all those jobs will be maintained there, in the sense that like all of them from the center, will they be moving there, or will there be more of a consolidation?
Sure, I'm happy to answer that. We are not closing the Wilton call center. We are moving the workers to a new site because the current site is inadequate for them. It has been inadequate for a while, so we've been looking for space. These workers did pitch in on contact tracing during the pandemic, but they're part of our team. These are the people who help us answer questions about eligibility for our services. We did look at other locations in the area, didn't find one that was sufficient for this team. And everybody who wants to keep their job can do so. We value all of our employees and will work with those for whom this change is a challenge. So the short answer is we are neither shutting down the office, we're moving the building, and we value every single worker and will work to make sure we help them adapt to this change.
Can you tell me a little bit about what made the site inadequate?
Things like there was only one bathroom for a lot of people, that it was a very crowded facility. So it was, not just the ideal place for our workers. We value our workers. We want to make sure that they have a work site that is modern and, really serving their needs better than that site did. Thank you.
Thank you. And I have a second question about daycares. A lot of daycares are still maintaining a 10-day quarantine for young kids exposed to COVID, which seems to be disruptive for a lot of families. Parents are wondering if 10 days is still necessary when the quarantine for most people has been shortened to 5 days, and will the state be issuing any more guidance to childcare providers on this?
Caitlin, we've got good news for you there. Several weeks ago, we did issue updated guidance around childcare facilities as it relates to quarantine as well as isolation, largely mirroring that which adults, the adult guidance, that is to say, 5 days of isolation followed by 5 days of masking, provided that the child can wear a mask. And then for those who are exposed and would normally quarantine, parallel recommendations for those that are in place with adults. That is to say, if a child was fully vaccinated and they get exposed, they don't need to quarantine because of the strength of the vaccines. If they're not, there are other qualifications in place. We released that, I want to say maybe 2 weeks ago, and it's available. And we did so again, recognizing that there is disruption that has been occurring, as well as the evolving data around the fact that it's really those first 5 days that really matter the most. So that's already out in the wild.
Thank you. We'll look for that.
Mm-hmm. Yep. And the last question for the afternoon goes to Patrick Whittle. Patrick, sorry about Cheddar, but let me turn it over to you.
Thank you very much. He always watches these briefings with me. I want to circle back to the all the way back to the beginning where we were talking about mask recommendations in schools, because I want to make sure that I'm characterizing this correctly. So there is not a mask mandate in schools statewide, but the Maine CDC offers recommendations about that subject.
That is correct, Patrick. There is not a state of Maine issued requirement for masking in schools. There is the recommendation from the Maine CDC that everyone in a school, students, faculty, staff, visitors, wear a mask, and that's consistent with the recommendation from the US CDC.
So the plan is to look at the data after winter break and to revisit that recommendation then.
That's correct, and assess whether it is appropriate in light of continued stability, if we see that, as well as the lack of an uptick, if we see that, to move that recommendation from a recommendation to an optional.
Right. And the local control, the final decision will still rest with local control, with local school districts.
You are correct. That's exactly right, Patrick.
Okay, got it. We've noticed that as hospitalizations have been falling around the state, and sort of the burden on the health system has been lessening somewhat, that some of the restrictions on visitation at hospitals have become less so. Like, for example, at Northern Light, Eastern Maine Medical, the window of visitation became much wider now than it had been. Does Maine CDC or the DHHS play any kind of role in recommending to hospitals what they do with visitation as the burden hopefully continues to become less and less?
Sure, I'll answer that, which is the short answer is that there is federal guidance on what healthcare facilities must do to respect the right of patients to see visitors. During the pandemic, there are provisions that allowed for restriction of visitation in rare circumstances for infection control. But I do think that now that we are in this phase, such restrictions are no longer needed nor advisable, because we know that visitors are critical to the mental health of our patients.
Okay, terrific. Unless you had something you wanted to add to that, Dr. Shah, I believe that was it for me.
Okay, thanks, Patrick. And thanks to all of our colleagues in the media for joining us this afternoon. A few programming notes before we adjourn for the afternoon. The first is I wanted to take a second, because we have not done so in a while, to recognize and thank our interpreters who have been with us through nearly every single one of these briefings, making them accessible to every single person in Maine. We would not be able to offer that access were it not for our interpreter colleagues. Alicia, whom is somewhat newer to our team, but Alicia McClurkin, who's joined us today, thank you, as well as all of the members of your team for being with us throughout all of these briefings. The last programming note for today is that we are changing the schedule of these briefings. We are shifting them from every single Wednesday to an as-needed basis. Clearly, there's enough going on that we'll probably be seeing folks again, but we will let everyone know going forward when these briefings will be scheduled, moving away from the scheduled ones to the as-needed basis starting today. So with that, thank you all for your time this afternoon. We appreciate everyone taking some time out of their afternoon to join us and hear where we are. As always, please be kind and take care of one another. Thank you.